Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, good morning. Myself, Dr. Ramdas Solanke. I am consultant neurologist at Orion City Care Super Specialty Hospital, Chhatrapati Sambhajinagar, Aurangabad.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Yeah, when we speak of seizure, see, brain actually works through electrical signal. Suppose I have to pick one object, so my brain will give signal to my hand to reach the object and pick it up. So it is done by the electrical signals. So when there is excessive or abnormal signals, or what we call it as sparking, electrical sparking, there is a seizure. And in seizure, patient may convulse, have jerky movements, shaky movements, and maybe unconscious, may become unconscious or be confused. That is what seizure is.
What is epilepsy?
We say a patient is having epilepsy when that patient is having recurrent and multiple episodes of seizures, and that seizure should not be provoked by fever or some brain infection. So that is what epilepsy is: having multiple and recurrent episodes of seizures.
What are the different types of seizures and do they affect people differently?
Yes, basically seizures are classified into two broad categories, whether they start from one part of the brain or they start from entire brain suddenly. So, depending on that, there are focal seizures which start from one part of the brain and in which patient can have jerky movements of one of the hand or one of the leg, and generalized seizures in which patient may have jerky movements of the whole of the body, or patient may confuse or may become unconscious. uh, Patient is affected in different way in depending on the type of seizures.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
The cause can be found or can be traceable in up to half of the patient in epilepsy. In half of the patient, it is not known, or current medical diagnostic facilities may not diagnose the exact cause. And remaining half of the patient, it is mostly either brain injury, brain infection, or some structural causes like brain tumors. And in elderly persons, especially after age of 65, Alzheimer's disease and stroke are the important causes.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yeah, as we speak of types of seizure, generalized and focal, the signs and symptoms may vary. Patient can have convulsive and jerky movements involving either hand or either leg or whole body. Patient can have staring look. Patient can become unconscious. Patient can be confused, or patient may experience fear or strange behavior. So these are the signs and symptoms we should look for, and when someone is having, we should consult doctors, especially neurologist.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
See, when general public faces the confront the patient of the seizure or epilepsy, the patient is having jerky movements, shaking movements, or behavioral abnormalities, or staring look. So these are quite fearful for general public to look, so they have avoidance and negative attitudes towards that. So there is a lot of stigma associated with the seizures and epilepsy.
How does this stigma affect people with epilepsy?
As these epilepsy patient faces avoidance from the and negative thoughts from the general public, the epilepsy patient has hesitant or reluctance to go to the doctors and to have treatment. So patient will continue to have seizures and will increase his morbidity. And again, because of that avoidance by general public and stigma, patient will have a lot of stress. This will again add to his seizures, which will patient will be having recurrent seizures.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Yeah, when there is a patient of epilepsy, what most common triggering factors we found is first and foremost is missing the pills. Second is missing the sleep or having less night sleep, and other factors like indulging in excess alcohol intake, smoking, not taking food timely. These are the most important causes or triggering factor, we can say.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Healthy lifestyle, not to smoke, not to drink, taking food regularly, taking medicines regularly, and most importantly, taking adequate night sleep, at least 7 to 8 hours of undisturbed night sleep. That are the most important lifestyles.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes, if the person is having seizures, first important advice we give to the patient is avoid driving, because when driving, patient will have seizure. He will definitely meet an accident. And at home, we generally advise to keep the surroundings safe, like wrapping or taping the sharp edges of the tables, avoiding the sharp objects in the house, keeping the surroundings safe, and using microwave when patient is alone at the home instead of using stove. So these are the basic safety tips during the seizure one should observe.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yeah, see, epilepsy is basically neurologic condition. It is potentially treatable, and the patient can have absolutely normal lifestyle, but it should be diagnosed and treated properly, especially a neurologist.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.